Basic science research is responsible for most of the medicines and technologies in our world today. And most people don't know that basic research is what we can be thankful for. As one example, very timely, one of the topics of some of our panels this week, GLP-1 inhibitors, which are helping millions of people around the world with diabetes and obesity, was originally found from basic research in the saliva of the Gila monster lizard. 2025 has brought about unprecedented changes in science policy, affecting the way that the NIH and the National Science Foundation will control and support basic science research in the future. My name is Aaron Mertz. I'm the founder of the Aspen Institute Science and Society program, which I started 6 years ago. We work across 4 intersecting pillars of science and community, public trust in science, global science, and science policy. And inspiring this panel today is our biggest project to date, the Aspen Institute's first feature-length documentary film, which will be out later this year. With working title, 6 Degrees from Science, the film will show and celebrate the benefits of basic science research to society, and will also show what we stand to lose if the scientific enterprise collapses amid changes in federal policy. I'm thrilled to welcome our panel today about basic science research with moderator Jonathan Wozen, and we have Mohit from AstraZeneca, and healthcare CEO Seema, and astronaut May. Seema and May are both on my advisory council at the Aspen Institute, have been with me since the very beginning 6 years ago. Thank you all.
Thank you.
Well, thank you, Aaron, for the great introduction. And yep. And thanks to everybody for being here. Good to see a good number of folks in the crowd. And we're going to want you to be part of this conversation. So I know in some of the other sessions today and yesterday, they've saved Q&A for the end. We're going to do things a little differently this time. So if you have a question, 10 minutes, 15 minutes in, feel free to raise your hand. We have folks with microphones that'll get you a mic, and we want you to be as much a part of the conversation as the people on stage are for this discussion about ensuring the promises of bold science. So as you just heard, we've got a really great panel and diverse panel for you. We have Seema Kumar, CEO of CURE, which is a health innovation campus based in New York City. We have Mohit Manrao, who's AstraZeneca's head of oncology in the US. And we're very lucky to have Dr. Mae Jemison, a former astronaut who made history as the first woman of color to go to space. She's also an engineer, a physician, and for any Star Trek fans, has made a cameo appearance on The Next Generation. So this conversation we'll be having with all of you is about ensuring that scientific progress that we've made in previous decades is sustained into the future. And as you've heard these past couple days, there has been a lot of progress, right? We have ways to edit the human genome, to equip immune cells to become more potent killers of cancer. We have weight loss drugs that are effective not just at helping people shed pounds, but in all sorts of other ways. And the list could easily go on. So I thought before we dive into all sorts of relevant topics about policy and how that affects innovation, I thought we could maybe give each of you a chance to say a little bit about what you're doing to try to push science into new territory. And maybe Seema, to start with you, not everybody may have necessarily heard of CURE, so if you could speak a little bit to what CURE is and what role you're trying to play in scientific progress.
Thank you, Jonathan. And it's wonderful to be here with this group of people and be talking about bold science, right? It's a favorite topic of mine. So what is CURE? At CURE, we sit at the intersection of science, entrepreneurship, and impact. What does that mean? We're an innovation campus. We're home to scientists. We're home to startups. We're home to investors and big thinkers. And what we try to do is to really help people traverse the valley of death. Because between bold science and the real impact of the science is the valley of death that entrepreneurs go through. And a lot of wonderful, bold ideas wither on the vine, die an early death, because sometimes it's because of funding, but many times it's because of not knowing the way from research to translation which is a key part of translating science into impact. And that's an important aspect of it because it gives science, it relates it to real life, it gives it credibility, it makes it more human-friendly. And so our goal is to really take entrepreneurs, be the Sherpas, be the GPS or the Waze for entrepreneurs, to take their discoveries all the way to market and to patients who really need them. So that's what Cure is. It's an innovation campus in New York City in Park Avenue South. Yes, go figure. You have wet labs and dry labs on Park Avenue South. We're a sister company of Deerfield. And just a little bit about me. I worked at Johns Hopkins, NIH, the Whitehead Institute, and Broad Institute, Johnson & Johnson. And so at Cure, what I'm trying to do is to bring the different parts of the healthcare ecosystem from basic science all the way to health impact and bring that all together in one ecosystem. So that's what Cure is.
Great. And Mohit, maybe to pivot to you, on the cancer front, we have seen a lot of progress there too. Cancer mortality rates have dropped by about a third since 1991, according to a study by the American Cancer Society. But there's still a lot of progress to be made, and we're seeing certain things that are a bit concerning in terms of a rise in cases among younger adults in cancer. So we'd love to hear, in general terms, about what AstraZeneca's vision for the future of cancer care is and what progress you've made to help us get there.
Yeah, thank you, Jonathan. At AstraZeneca, we feel we are in this golden era of science. The progress we as an industry, as an ecosystem has made in the space of cancer in the last 10 years is much more than we had made in the previous 100 years. And from that perspective, this is the golden era where we are seeing that we are following science at AstraZeneca and being able to really understand at more granular level what drives cancers, what are the complexities of cancers. And based on that, we are focused on developing or discovering, developing, and delivering medicines to ensure that we can achieve a bold ambition that we have laid out for ourselves, which is to one day eliminate cancer as a cause of death. Now, it's for sure we cannot do it alone. There's a lot of ecosystem players all the way from basic science to delivery on the bedside that we need to collaborate with, work with. But today where we stand, it's phenomenal. On our side, we are building a portfolio of assets both around modalities that help kill cancer cells directly and bringing precision medicine into it, which is like radioconjugates, antibody drug conjugates, epigenetics, and understanding that. But also on the other side, uncovering the power of immune system and seeing how we can actually use the immune system itself to deal with cancer. And areas like cell therapy is a huge progress there where we are re-engineering cells and entering it back into human body. And I can talk about it later, but also can we do it in vivo for the medicines of the future? That's where it's really an area where you can think bold and think about one day eliminating cancer as a cause of death. You talked about, adult patients or younger patients getting cancers, and that's a stat is scary. But I think it's also important to understand why. While we do that, it's also important to do what we have in our control. From where I sit, I see science moving very rapidly, and today one of the challenges we have is the delivery side keeping pace. Can we go early, intervene early, support that, and deliver care? But also, what is needed for tomorrow? And I'm sure we'll get into this panel. I think there are 4 areas that we need to ensure must happen, which is first and foremost, we push the boundaries of science and continue to have that quest to do more. Second is leverage technology to ensure delivery is catching up. Third is policies, as you listed out, is critical that they are available for ensuring patient experience, patient access, but also policies around ensuring scientific investment is not put on the back foot so that we don't see a decade after the progress slowing down just because we didn't invest today for the future that is ahead of us. So those would be kind of my thoughts.
Well, yeah, we'll definitely get to policy very shortly and have interesting conversation there. Dr. Jemison, just to turn to you and to pivot to sort of a different frontier of science, maybe the last frontier. Don't mind the Star Trek joke. A lot of folks know you for your time aboard Space Shuttle Endeavour. They've obviously done a ton of things since then, and now we were talking a moment ago about you're running a nonprofit effort called 100-Year Starship to make sure that in a century's time that humankind can travel beyond the solar system. I think it might be interesting to give folks a sense of why that's important and what that can do for our future and our present, and also for our health, because people may not know about that.
Okay, so I have my piece all set to start off, and I'm going to start off this way anyway. Okay. Helen Keller said, science has not found the remedy for the worst evil of them all, the apathy of humans. And so when we start to look at health for me, when we start to look at this whole idea of what science can do to impact society, we have to always understand that we have choices as to what we do. We have choices. And who are the gatekeepers? That is, who has access, who allows people for education, who put the money in, who train you for your research position, who gets it into, who has the rockets that, fly, whatever. Those gatekeepers are really important. Mm-hmm. And so that has really informed so much of what I do. And my background was first in engineering and chemical engineering, then I went to medical school. And I started working in developing countries because I love the idea of where you had to pay attention to what was around you. You had to make those observations. Mm-hmm. And those observations are really critical to how you take care of people. And when we think about health, so frequently we think about what we do to people, but the reality check really is that health should be optimizing everything such that people have the best opportunity to reach their potential, whether it's physically, physiologically, mentally, or spiritually, and that then they can make contributions to the world. And I think that when I start thinking about all of that, those things influenced what I did with 100-Year Starship. So 100-Year Starship was a program that was seed funded by DARPA, the Defense Advanced Research Projects Agency. It was funded to try to see if we could get the capabilities for human interstellar flight in 100 years. Interstellar flight, going beyond our solar system to another star. Now, when I said, hey, I know how to do that, it was really about creating a proposal that would connect something that seems so far off to our life here on Earth. And so the name of our proposal was called An Inclusive, Audacious Journey Transforms Life Here on Earth and Beyond. And what I understood, because of the word inclusive is at the front, is because, first of all, you cannot do anything that big with just one discipline. And so it has to be across disciplines from the very beginning. And you have to use the full scale and talent and scope across the globe of possibilities. That was inclusive. And we have to make sure that things are happening right here on Earth. So I'm going to do space for you real quick. So what could interstellar have to do with going beyond our solar system? I mean, going beyond our solar system have to do with life here on Earth. When you think of space, people don't think of health, right? Mm-hmm. But think about space as a platform. Even when you're on the International Space Station, there's microgravity, you have a toxic environment, you have constrained resources, you have people who have normal physiology, you put them in an abnormal environment. So what can you learn from that? You can learn lots of things in terms of what happens to the cardiovascular system of people who have normal, good hearts, and it deconditions. It deteriorates in weightlessness. But I can talk about this all day long, but I want to go to one that perhaps is even a little bit more surprising. That is, you can use the vantage point of space to look down at the Earth and help to start to determine what may be going on with people's health. Yes, pollution, we think of that. Mm-hmm. But think of remote sensing. So this is being able to tell something about the landscape, right? What plants are growing, how much water there is. You can look at vector-borne diseases like malaria, schistosomiasis, diseases, Lyme disease, right, with ticks. When you start to understand what the landscape is, you start to predict what may come next. This is something that only happens when you have people who know about health, who know about disease in different countries, also know about some of the capabilities of space. So the bottom line, when I go along with how do we get bold new things, is that you have to have a really powerful, transdisciplinary, diverse group of people working on it. And that doesn't just mean biologists. It doesn't just mean physicists. It means people who are in the social sciences and culture, because they can tell you about all of this. So that's my piece on space.
Yeah, good. So, all the things that you guys laid out a moment ago in terms of whether it's cancer or space or whatever the area is, I think as everybody just goes beyond what any one scientist or company or lab can accomplish, right? There's a larger ecosystem that supports science. And the federal government has been historically a very large and very important part of that ecosystem in supporting the basic research that leads to new tools and technologies. I think we all know the role of the federal government in supporting science has become very shaky. It's hard to predict from one day to the next what the administration is going to be saying in terms of funding, what the layoff situation is going to be, who's still going to be employed within some of the agencies that deal with science. So I think we do need to spend a little time talking about what the shifting science policy landscape means for our ability to actually deliver on any of the things that you guys were laying out. Maybe to stay with you for a moment, Dr. Jemison, I know when you were a professor at Dartmouth, you were involved in writing a report called Seeing the Future and thinking through what the future of public investment in science should look like and some guiding principles. So yeah, would love to get your thoughts on the current policy landscape and sort of what kind of position you see us in right now.
So Seeing the Future was born as science, engineering, and education, and what are the best uses of public funding for basic science research. And we got together a number of people, National Medal of Science, National Medal of Technology winners, presidential early career winners, theologians, economists, to have this grassroots conversation. And the conversation really revolved around how do we ensure the health of the science enterprise? And one of the things that happened with people coming from industry, they said, while industry seems to be really budding in terms of the amount of money spent on R&D, the person was really concerned that it was mostly on development. It was on little bitty incrementations. Yes, it was money on development, but it wasn't doing that hardcore, bold, basic science research. And that path has sort of continued. Now, as we ask the question before someone does the research, what is going to be the answer and what are you going to do with it? That would mean that we wouldn't have done a DNA and RNA research, which allows us to do the precision medicine. Remember, some people in here remember with me about lasers. Remember when you were a little kid, lasers were the coolest thing in the world, but no one knew what to do with them. They just showed up on Johnny Quest, the cartoon. But now lasers are commonplace for skin resurfacing. They're present in medicine for everything. So it was that basic research that made a difference, and that's one of the things that we're having a problem or issue with. What Seeing the Future came up with 10 questions to ask. None of the questions were prescriptive, but does the science, for example, create a new tool? DNA sequencing was a new tool at the time, right? So it made a difference. Scanning electron microscopes were new tools, particle accelerators, which would allow you to do more observation. It asked questions about the risk-benefit. That risk-benefit is not just how much money is spent, but what's not spent on other projects, right? So there's just these list of questions to be asked of a project. And the other one that I think was really important, do the projects promote the vitality of science? That is, being willing to ask those questions out of curiosity, that we have no idea where the answer is going to go. And so those things, for me, were very important. And I'm really excited that with the Aspen Institute, we're looking at redoing some of those workshops and programs with the new Seeing the Future, because it's really critical that we move forward right now and not be afraid to say, basic science research is important, and it's important to have lots of people involved.
Seema, I know Cure recently did a survey of sort of CEOs and other folks in the life sciences space to gauge how people are feeling about the policy landscape and just the overall level of optimism or pessimism, if you want to call it that. Be interesting to hear what you guys learned out of that survey, any lessons for people in the audience.
Yeah, I mean, it was really interesting because these were CEOs who are working on some of the biggest, boldest breakthroughs and translating them into human health impact. And it was sort of, in one sentence to summarize it, it seemed like people were saying it's the best of times, it's the worst of times. So on the one hand, never been more excited than today about all the technology we have. I mean, the babies, that was cured with the CRISPR gene editing, to AI and to gene therapies and CAR T and all of that's happening. Science is having a golden age, continuing to flourish. But at the same time, I think that there was this worst of times in terms of the policy and some of the NIH funding cuts and all of the new sort of everyday changes that have come through very in quick succession. So one of the comments was that never before have we've seen changes happen, but never in such quick succession and back and forth, right? And so that has caused people a little bit of anxiety. So 87% of the people who were surveyed said that they are highly concerned about innovation and that the crown jewel of the United States enterprise, which is its basic science infrastructure that comes out of universities with NIH funding, is being dismantled. Infrastructure as we know it is being dismantled. That said, I think the whole same group of people said that they are highly optimistic that science, the new technology, and the talent, more so than anything else, that the talent is going to actually shift the game. And what we need to do, critical to success for this enterprise, the innovation engine to continue to succeed, would be to bridge the gap between where we are today and where we need to be. Disruption is often a catalyst for innovation. To look at things that we could change, to look at alternative sources of financing. Most people in the financial industry know, even those of us who have 401k plans and all of that know, that you never put all your eggs in one basket. You have to have a little bit of a diversified portfolio. And so in addition to having public non-dilutive funding, we need to make sure that we have alternative sources of funding also identified, such as philanthropy, such as venture capital, such as alternative ways of looking at creating new financial models that are blended financial models that can bring forward non-dilutive funding. And so having worked at the Whitehead Institute and the Broad Institute, both institutions that were actually started by a philanthropist, Jack Whitehead, for example, or Eli and Edie Broad, was this desire to set up an independent research institute that was going to work on basic research that nobody else was paying attention to. That led to the Human Genome Project work that was done in Kendall Square. Look at Kendall Square, where it is now. So I think that there is a way to kind of, for what we heard from the CEOs, they're optimistic because we have the talent, we have the technologies, and we have entrepreneurs and people who know how to pivot. Now, there are a lot of people who've been, impacted as a result of all of the cuts. And so this is another piece of talent that those of us who are in pharma and for-profit sector could use. And then the public-private way of interacting is going to be important. There's 10 recommendations. I won't go into all of those that they made. But one thing is for clear is that for too long, this sort of where we find ourselves in an inflection point is that we have made it work by operating in silos. Basic research here, translational research here, investment here, pharma, biotech, pharma, and payer. And it's been fragmented and siloed. But this is an opportunity for us to work in a much more integrated way in a new healthcare ecosystem that we can shape for the future. So that's the...
Okay. So you mentioned some of the things you're hearing from a large fraction of CEOs. I mean, one thing you just hear and feel from everybody is that there's a ton of uncertainty right now. And so maybe, Mohit, to move to you, you guys at AstraZeneca, you have to make decisions about what programs to advance, what to prioritize, what to deprioritize, and there are all these sort of looming questions around drug pricing and what the administration is trying to do there, around what the FDA strategy is going forward, around who's even going to be working at the FDA day to day. So would be interested to hear more about what your biggest thoughts or concerns are, and just in practical terms, how do you move forward amid all of that uncertainty?
Yeah, Jonathan, just both of my fellow panelists covered really well the importance of basic research. And I kind of think of policy as what is needed for policy for today, tomorrow, and day after. I think investment in basic research is absolutely critical for the day after tomorrow, right? And that's where we are benefiting from what investments went in that unlock precision medicine. I want to pivot to a little bit, before I answer this part of your question, into what do we need for policy of today? We have had such amazing science come through fruition and data available, regulatory approval done. And I give you an example of Rachel in Atlanta who is going to a physician and trying to get treated in a community practice on oncology. She's getting lost with her biomarker not being reimbursed, right? Is there policy to unlock biomarker reimbursement as a base? Because we have proven precision medicine is there. 20 states have done that. We need to get it more. There's also prior authorization that a physician gives up because they're busy with documentation after I heard yesterday there was this announcement with insurers that we want to remove that. We have to remove that for every zip code and every patient to have access, right? But then there's policy of tomorrow, which is, are we working on regulatory frameworks that help us identify what endpoints to use? How do we accelerate? How do we ensure clinical trials are diverse so that we are understanding what populations will benefit or not? And then there's policy of future, which was, we talked about basic research, and we need to ensure investments remain there and we protect that so that we can uncover more understanding of biology and basic research to then understand, oh, lasers will apply here or what will apply there. I mean, today we are benefiting from some of those. To your point on uncertainty, I think the field of science is, it was covered very well, that we don't know what we are today looking at and learning and where it will go, right? The beauty of the system is once we know that, we try to experiment and run right experiments to understand, will it work? It is a long process on where we get to. But when there is uncertainty of return at the end of it, and there is a good understanding of how much and for how all, so that you can bring back the investment, it drives innovation. And I think an example that everybody has talked about is from IRA on unintended consequences on orphan diseases, for example, right? Orphan Drug Act, and it was talked about yesterday. It was a big game changer on prioritizing development for rare orphan diseases, by the way, which 1 out of 4 Americans suffer from. Only 10% of rare diseases have a treatment today, and that's after 600 treatments being developed based on that 4-decade-old law, which put right incentives. Go for those, understand, and develop certain things. Orphan drug exclusion in IRA said if you are going beyond 1 orphan, you're not excluded. That means you're disincentivizing someone when now they know the science could work somewhere else to not go there, but prioritize investment elsewhere. So I think those are the nuances of unintended consequences on policy. And when uncertainty is introduced, it just makes you pause and think what other choices I have and where the investment should go in. And that's something it's critical to think through on any policy impact or policy things we are having is what is the consequence today, but unintended consequences that may prioritize or deprioritize certain areas. And we need to keep incentives in place all the way from basic research to delivery in clinic on bedside today.
Jonathan, if I could just add one thing. I think that there is broad acknowledgement that, hey, listen, has there been inefficiencies in the system over the course of decades, right? Every organization, I mean, we all know, any new organization, any new CEO comes in, is going to look at it and say, okay, is there a way to reform things? Is there a way to make it more efficient? Is there a way to modernize something? Why submit FDA packages in like this? Why stand by the fax machine waiting for your FDA approval instead of being able to use, send your stuff by DocuSign or what have you? So there is modernization, I think that is called for. I think that the biggest message we also heard is not to feel immobilized by the changes, but to try to pivot and look for alternative ways and to also at the same time advocate and figure out how to work in this new reality.
Yes, Seema, I'll extend on that. And we had that conversation at the breakfast the other day where we go to find common ground. There are common ground on both sides, things that we need to continue and things where there is potential opportunity to optimize and do that. But we shouldn't put a blanket approach and go for a radical change. But I think there's opportunity, and this is why Aspen Ideas exists, in terms of coming together from different stakeholders and bringing ideas and finding common ground to push the needle on.
I want to add something in the conversation that's going to start off with, and I have these quotes that I really like because they summarize things. So Zora Neale Hurston, she said, truth is a letter from courage. So sometimes we just have to come out and say certain things. There are a couple of things that are going on right now. In some ways, we are a victim of the success of science because people think it's easy and they think it was just standing right there in front of them because by the time it hits the news, it's already quote unquote successful. So there's a victimology there that we believe that it's just really easy, which brings us to science literacy. There is a lack of science literacy across the board in the US and probably many places around the world. And science literacy isn't that you're able to solve all the equations, it's that you're able to read an article and understand what it means, that you had some experience as a little kid doing science projects and doing things with your hand, and you understand that there's failures and there's successes, and everybody needs that level of science literacy. And I think that we see that playing out very much in politics these days, this lack of science literacy or lack of appreciation. Now, the other part of that I'm going to challenge is I'm like the world's internal optimist, but then I also have this like short-term pessimism. But
I think that's what we're seeing, like this immediate short-term pessimism, but the eternal optimism.
We need to channelize our optimism and go to...
No, but the pessimism comes because it's like, that's the reality check. Here's the thing. What's going on today could be very damaging for a long period of time.
Yes.
And it could keep people out. And then the other part of that is, you probably heard me use, and inclusive was the first word on the 100-year Starship. And I meant it, inclusive across ethnicity, gender, geography, inclusive across disciplines. The United States, if we're talking about the US, but if we talk globally, the people that folks have fantasized in their minds are always the ones who do the research, right? Who come up with the scientific discoveries. That's not what our population looks like. If we're not educating all of our children, all of the talent that's available to us, and taking advantage of it, we're not going to be able to count on things. Right now, when you talked about, Seema, that we have all this talent in the pipelines, been some remarkable advances. There's still been in engineering and some other places, but they need some help.
Yeah.
But there's been some remarkable advances. But that's not going to be true if we cannot use the word woman in a project. We were talking about women's health. You can't talk about gynecology without using woman in the title. There are all these issues that we have to do. So the truth is that we really do. Yes, there's common ground, but the reality check is that certain things are true and certain things are needed. And we can't, just because whatever way we want to think of the world in a different way, Mother Nature doesn't care.
Mother Nature doesn't care, and women are half the population of the world, and it's a big, as we all spoke about before, $1 trillion opportunity. So financially, business-wise, it doesn't make sense, right, to not do that. But I think what you brought up something else that we talked about, which is the trust factor in science and just in the whole healthcare, infrastructure, is at an all-time low, right? So the part of it is like building that credibility and building that trust back up. And I think what we're seeing right now is really that trust being at an all-time low. And therefore, that public support that we had before, we need to build that back up, and we need to ensure that we're doing the kind of things that we're doing here at Aspen, engage with, the people who are the beneficiaries of science, not just the people who are doing the science, right?
And those beneficiaries, those people are also the ones who are paying for it.
Yes, exactly.
So when we start to look at government funding of science, it was the school teachers, the taxi drivers, the janitors, the secretaries, all of those folks who were paying taxes in, who were allowing researchers to do the work. And we have to steward that money and never forget that they are as much a part of this as we are.
Absolutely.
So, and I'll encourage the audience, anytime you have questions to raise your hands, but I'll jump in with another question. It's unclear, I think, at this point, whether some of the proposed cuts to scientific agencies will actually turn into reality, but at least the House has passed a 40% cut for NIH. The administration proposed big cuts for NASA and other agencies. I would love to get your thoughts. Are we headed towards a future where the funding of science is increasingly privatized? And if that happens, how do we view that, as a positive or a negative? Maybe Dr. Jemison, I'll start with you in terms of your thoughts on that. I mean, we've seen SpaceX, Virgin Galactic, Blue Origin in the space context, but that's not only, yeah.
So there was a history where science was funded privately for a long time because there would be patrons of science and they would do things. And then there was the gentleman scientists who had funding to be able to do this work. Those days are gone. They're not going to be here. The other question we have to ask when it comes to privatization of that, who gets to be the gatekeepers of it? And there is a very different mechanism in science where we talk about peer-reviewed research, where you need to publish your data early on so people can look into it. That would not always be in the interest of purely private research. So we have to be really careful of what we think of. I think you people may have heard me. So people talk about the commercial guys going up into space, and oh, it's really great. And yes, it is. And I had the pleasure of being there with Blue Origin, with the 6 women who went up. And what was really interesting is there was a lot of blowback on that.
Yeah.
And there was a lot of blowback. I think it's because it was women. Because William Shatner went up, they had a whole bunch of Blue Origin launches before those 6 women went up. But it brought space back in the context. And that is, who gets to be the gatekeeper? The reason why we can do commercial space like we can now is because our parents paid for us to learn how to do low Earth orbit, go to the moon, go to Mars, all of those things years ago. And so now the commercial industry is benefiting from that crew-orientated ability to do it. And by the way, NASA helped a lot of them, helped them and paid for them to do that research and get there. So I think we have to be really careful when we talk about privatization taking over what really was allowed for this boom. We talk about being in the golden age now because that work was done in the 1940s, 1950s, all the way up to now.
And it's also important because when you do basic research through NIH and all, you're looking broad. You're not really focused on that's my private goal, etc. And that is really valuable. And so I think there's a role for that to continue, and we need to support that. And we need to ensure that we support and defend for investments needed all the way across the crown jewel, as we call, of the life science industry that we've built here on many taxpayer dollars of research that has happened in basic, but also later in terms of development of drugs and bringing medicines to practice.
Yeah, I think the important thing is that it's non-dilutive funding, right? Which is different from funding that is very focused on a specific milestone. So non-dilutive funding allows you a long runway to pursue something for 6, 7, 8 years, failure after failure after failure, until you hit jackpot, right? And so that's why NIH funding is so important, because it's curiosity-driven. It's the bold entrepreneurs, the scientists who think of something that you would think belongs in science fiction books. But they think of it. And today we were talking about George Church, who wanted to bring back dinosaurs and, old, animals. And it was like extinct animals, I should say. So you would think, okay, Jurassic Park, come on, that's movie making. But really, there is a real tiny little woolly mammoth now in existence. I'm not saying that's the best example, but what I'm saying is that people imagine science fiction like things. These are bold entrepreneurs who are thinking that way, and funding exists to do that. That's what ends up being, you can take one gene. Right now at Cure, there's a company that's working on single administration gene therapy for Alzheimer's. One injection at the bottom of the brain stem for ApoE homozygous patients, and that's it. That's the end of it, right? You're cured, but it's going to cost about $5 million for that single therapy. So we have to figure out, as society goes forward, You have bold advances. You have, on the one hand, non-dilutive financing that gives you a long runway to discover these bold things. But then you have VC that translates it. And then finally, there is a payer system that has to pay for these bold advances. So I think that all sources of financing are important. But while we have funding cuts, we have one of two choices. We can go advocate, we can educate, we can talk about why basic science is important, advocate for investment in basic research, investment in NIH, funding for universities, all of the above. But in the absence of being successful, and while we're doing that, we can't stop not supporting the progress of bold science. And one way to do that is to take private capital, to take philanthropy, to take other sources of funding to fill the gap. So suddenly the bridge, is destroyed. You can't say, okay, how are we going to cross the river? Yes, you put some, planks of wood and some rope together to make sure that you're able to cross the river and get to the other side and not just give up, right? And so we have to do both. So it's not one or the other. There's a word called and. You can have this and that, right? That's I think how we should be thinking broader.
Yeah. You talked about the importance of advocating for basic research in this moment. We all live in sort of bubbles in a sense. I think in this room, there's probably a lot of support for the value of basic research that may not be universally felt. So, as people leave the conference and go back home in the next few days, I think people would love to hear any thoughts on, what's the right way to advocate for or to communicate the value of scientific research? What works? What doesn't? You spent a lot of time in various science communication roles through NIH and at J&J and at Cure, but would love to get thoughts from multiple folks on the panel about what does standing up for science or talking about the value of research actually look like, or what should that look like right now?
I think standing up for science means really being able to communicate why science matters to people's daily lives. And so what has happened a lot of times is that we've not been good at doing that. We've been not engaging the public, not engaging Congress in really on an ongoing basis, right? Like you said, you finish all the work and then you go and talk to folks. You have to bring them along on the journey. That's one. The second thing is you do have to listen, and I think the listening skills become very important to understand why somebody who does not or is challenging you is asking those questions. So we have not been good at, and we do need an explanation of why indirect costs of taxpayers' money is 68% or 80%, right? And so you can't shoo that away. You need to give a proper answer. An answer may be justified. It may be the right number. But you have to do that. You have to do that. And so if you look at it from the public, and the taxpayer, they are saying, okay, if you think that this is the crown jewel of the United States enterprise and that we have a healthcare system that is the best, why is the United States not healthy? Why are people left behind? Why do people not have access to care? Why are people showing up at the hospitals have no insurance or no therapies available? So the question is, at the end of the day, you have to measure impact by, what people feel and the healthcare outcomes. And so I think connecting the dots across the whole thing is important. And the different parts of the ecosystem have been finger pointing. One day it's the bad pharma, another day it's the FDA, another day it's the payers, another day it's the scientists. So we have to kind of really look at it in an integrated way and explain it, in a much better way than we've done in the past.
I think we've got a question up in the front, so we'll give somebody in the audience a chance to chime in. So if you want to say your name and then share your question.
Oh,
Okay.
Yeah.
Hi, my name is Brianna. I'm a PhD candidate actually in translational biology, medicine, and health at Virginia Tech. And so we do a lot on understanding the translational continuum. I'm a T4, not a T0, but as a T4 of public health, I always look back, whereas my peers that are basic have a hard time looking up. That being said, I like this idea of the scientific ecosystem and that we need to bring people along. It needs to be a dialogue. So I'm wondering, have you seen that been done tangibly and effectively? And if not, ideally, what would that look like, especially for scientists to still maintain that credibility and that voice? Because we have a lot of people that think research is just going on TikTok, and they haven't even cried over data yet. So I'm like, how can we maintain that credibility while bringing people along to truly have a scientific ecosystem?
I'll take a crack and then well, first of all, the Aspen Institute itself is doing a great job. Aaron mentioned the documentary. So I think that documentary, because really, you can't do it in nature and science. The explanation cannot happen in those sorts of things. You do have to use TikTok. There is a influencer called Lab Shenanigans. And, Lab Shenanigans goes and he's like going into his lab and he's looking at something he's doing. I mean, it's a great way of engaging with the next generation, right? So you do have to meet people where they are. If it's on TikTok, if it's on Instagram, so be it. But the other thing I will say is that there have been many programs where communicating and engaging with the public should become a part of the medical curriculum, should become a part of the science curriculum. This has to be a required course to get a degree from, in science, a PhD in science. You should be qualified to do that, just like, other disciplines. So people who are engaged in the scientific medical disciplines should have that as a requirement. And so I think that that's part of the...
Yeah, just maybe connecting this question and what you were asking, I think it's important for us to meet people where they are, like Seema said, and in simple terms explains what science can do and is doing. And it comes when it's a personal story of someone people can relate to and connect. And I'll give an example. We just, in May, we had just launched our new cell therapy site in Rockville, Maryland. And we had a patient come there who talked about a 70-plus-year-old patient who was healthy, fit, that does hundreds and hundreds of miles of cycling, and then was hit with his disease and totally changed his life. One dose of cell therapy, and he's back on riding his bike. That kind of messaging, and then connecting that. How did we get to that cell therapy? Where did it start from? What did we learn? How was it developed? What's the entire ecosystem behind it? We need to explain that to policymakers. We need to explain that to general public. But we need to meet people where they are. If they are on TikTok, we need to meet them there. But that's the importance of what science can do. And I almost thought Jonathan asked the question because he saw my pin which says what science can do. Everybody should carry a pin, but please ask Dan for that. But yes, we need to be ambassadors of bringing that personal patient stories to life. And by the way, each one of us, one way or the other, is touched by diseases where either our family members, loved ones, have had the impact of science. And if we can bring that to life, it will help us bridge that gap.
And Aaron, you wanted to ask a question. I'm going to...
Yeah, could I? This will tie everything together. This is something we talked about over the years with our advisory council and with Mohit too. I'd love to hear in this public forum, how amid all of these policy changes this year, do we not lose an entire generation going into science?
So Aaron, I really want to say this because I see the clock counting down. And I think the one thing that we've left out, I don't know if I mentioned at Dartmouth, I was an environmental studies professor. And so I spent a lot of time looking at how do you develop technologies, advanced technologies to look at and to try to keep sustainability. But that's the whole world. One of the things in the documentary that was done, I think, is someone who is working, he says, on marine ecosystems on the other side of the world. And they asked people, like, what does a marine ecosystem on the other side of the world have to do with life here? Well, it's because the Earth is an entire ecosystem. And guess what? Our health is really dependent upon, I'm not just talking about climate and biodiversity and stuff like that, but so much of disease is not nature, it's nurture. Whether it's nutrition, whether we have to look at health much more broadly, exposure to toxins, education, all of those things are part of it. And if you want to ask me what I think happens when we go out with health, with policy, it's to understand that our health is not just the things that we take into our body. It's the whole developmental process that goes along perinatal, prenatal, the whole time. And so I think that's really important to take away. And the last thing I want to do again is push on experiential science education, because you can tell people stuff all you want. You can tell them hard-tearing stories, but until they figure out and feel that, okay, if I do this, this happens, and so science is actually connected with me, and it's not something that's mysterious. It's something that's about understanding the world around me, and technology is putting that understanding into some use.
It reminds me of a quote. You shared some quotes earlier, but a Confucius quote, tell me and I forget, show me and I remember, involve me and I understand. So maybe a good note to end on. Very important, timely conversation. Thanks for the questions, and thanks to our panelists for being here.
Thank you.
Thank you. Thank you.